Muted you. And I'm requesting all to keep your videos on if possible. Once again, good afternoon to all. Today we are going to discuss on the second part of communication. We do have an eminent faculty joined us, that is Stella ma'am. Lieutenant Alice Stella Verginia. Welcome ma'am, welcome to the session. And when we talk about Stella ma'am, yeah, she has completed her DNM, RNRM, BCCPN, NFPN, and she worked with military hospitals in India and Ministry of Health and Sultanate of Oman and Libya, and in Government Medical College Calicut also. She was a master facilitator trainer of international and national faculty for training programs in palliative care. Participated in the development of palliative care curriculum for undergraduate medical and nursing students. Contributed in developing manuals for doctors, nurses, volunteers, and students in palliative care. She has presented papers in international conferences of Indian Association of Palliative Care and has conducted workshops. She is practicing palliative care since 2007. She has won a lot of achievements in her career and welcome, ma'am. She is such a humble person, I should say. Thank you for being here with us, ma'am, and over to you. Unfortunately, our facilitator is not available today. She has got some she has got some sudden medical emergency. So,
Thank you, Senior, so much for the wonderful introduction. And so she has not joined. Okay. I'm still having that glare problem is there, but anyhow, it's okay. So welcome to all the participants. So today we are going to have a session on breaking bad news and collusion. Okay. So already you had a very wonderful session with Dr. Sunil, I hope so. Dr. Sunil took the session, right?
yes,
yeah, so Dr. Sunil has already spoken to you about the basics of communication with the patient and family. So I'll just share my screen. Sinia, one problem is something has happened to my computer, I think, laptop. Just now I finished one session, one more session, but I cannot make this one as, what is that, slideshow. I don't know how to do it also. You are wrong, enhanced description.
Can you please send it to me? I can share it from my end.
That I cannot send also now. If I have to send, I have to leave everything.
Okay. So
this is clear, right?
This is clear. This is clear and visible.
This is clear only. Okay. No, what happened? When I projected first, something I don't know, somewhere in the settings I had just done something. So I have to come back to that. Okay. Just now only I finished one session. So I was not having the time to do it. Okay. So welcome to all the participants. And we are going to have about the communications in second part. So before going to the second part, I would just like to do a recap of the first part so that we can go for the second part. Okay. Just some things which we have to talk. So first and foremost thing, breaking bad news, collusion, asking difficult questions and all. There are a lot more to talk and you need to have a lot of experience in talking to the patient and the family. Okay. But in our day-to-day life also, it is very important to do communication. So you have already learned the basic things and the importance of communication. So usually we say the importance of communication is to relieve the anxiety of the patient and the family, and so that the better adjustment will be there for the disease process. When we come to know that we are suffering from a disease, we are diagnosed with some disease, which is a progressive or which is an incurable one. Usually if we come to know, we start adjusting with that process. Of course, it is difficult to accept it, but there is no other go also. We need to adjust with that. So, okay. So that once our anxiety is addressed properly, many of our physical problems will reduce. And of course, you know that it's why we need to communicate is that because for the exchange of ideas or feelings, to get the information, also to give the information, both the ways, and for proper guiding and for better compliance. Once we know everything, we can guide a person properly so that there will be a better complaints. If suppose a person is telling you, whenever I am eating little spicy food, I am getting epigastric pain, burning sensation, I will tell the patient to reduce the spicy food or to stop the spicy food. Okay, so that is a proper guidance. Taking metoclopramide tablet for nausea and vomiting before 45 minutes of the food. That's a proper guidance because there will be a better compliance. Okay. Involvement of the family is very important because that will reduce the isolation, self-isolation, social isolation, and of course, family isolation also. Okay. So, and not only that, we can teach the family and empower the family how to take care of the patient, how to communicate with the patient. And of course, the acceptance and trust. That is very important. And if we fail, it is usually the poor symptom control. If we don't address properly, there will be poor symptom control. The patient will keep on complaining of his problems. He won't adjust with us. There will be lack of cooperation. Patients become too demanding, and sometimes, of course, medical legal problems will be there. So in that case, we need to explain to the patient, let it be for giving medications or anything, that communication is very important with the patient and family, how to take a medication, how to give a bath, how to make a occupied bed. Let it be for anything. We need to communicate it properly to the patient and family. So you know the basic principles of effective communication. It's unconditional positive regard, genuine empathy. Empathy is very important. Putting yourself in somebody else's seat. Okay. So empathy is very, because we need to understand, try to understand what the patient is going through, what the family is going through. If you don't understand the sufferings of a patient or a family, you won't have empathy for them. You won't have that unconditional positive regard for them. You won't be genuine to the patient. So you need to have empathy. And you know, history taking is very important. Whatever the patient says, just listen to the patient with your 2 ears. So more of listening and less of talking. And how? Open questions, encourage talking, tolerate silence. This all you have gone through, just as a recap. Avoid unnecessary interpretation. Patient is talking about his nausea and vomiting and you're much interested about the patient's pain. No, prioritize. If the patient is saying, I cannot sleep, I'm so worried, I need to explore from the patient what it is worrying. Please don't jump from one thing to the other. Let the patient complete his history. And of course, show that verbally and non-verbally you are hearing. Summarize and prioritize the agenda. It should come from the patient side. And of course, empathize and give a realistic hope. Remember, our body speaks more than words. The posture, the eye contact, touch, gestures, the tone of voice, these all are very, very important. Our body speaks more than what we are talking. And of course, the barriers, main barriers, pretending busy, looking at the watch, looking here and there, pretending busy, concentrating on it, because I'm happy to listen to the patient's physical problems, but I'm not happy to listen to the patient's other problems because I don't know how to handle it. Comparing the patient, look at him, he's better off. Why you are always crying? Look at that patient. He is also suffering from same like your disease only. So don't comparing. Don't show sympathy to patient. And please, please don't use medical terms to the patient. Whenever you talk to the patient, try to use a simple terms which the patient can understand in their own language, not in our language, their own language. That is very important. So now we are coming to the difficult situations like breaking bad news, handling collusion, and handling difficult questions. Breaking bad news. Can anyone tell me who has to break bad news and what is this bad news? What is bad news? Anyone? Yeah, someone is going to talk. Yes, please. Can you just tell me what is breaking bad news?
Afternoon.
Hello. Yes. Yes, sister. Tell me, sister. No problem. What is breaking bad news and who should break the news? I can hear you, sister. Hello?
Sister Mehboob, you are muted. Please unmute from your end.
Yeah. Tell the sister member.
Yes, ma'am. Good afternoon. It's
Yeah.
about diagnosis revealing, or sometimes if a patient is dead, then telling
Let
it
it
to
be
the
anything. Let it be anything. I just meant breaking bad news. Who should
especially
relieve
the
it?
doctors. Especially the doctors, they do,
Especially
and we are
doctor.
accompanying the doctor with silence.
So my question is, do you think only doctors has to do this breaking bad news?
When you are in charge of the department, or like in charge of a patient, then you can also do the things
Okay.
if you are fully confident and know about the detail.
Detail. Okay. Very right. Very right. Okay. So we will see about the breaking bad news. As you said, it's okay with the doctors also, but a person who has full information of the patient and the family, and a person who can do it, who knows, who have the skills to break the bad news can do it. Because it's a very bad situation, we have to handle it. So that person who is going to break the news should know how to handle the situation also. Any emotional part comes, so they need to know. So we'll come to that part. Okay. Breaking bad news. Why? Why we have to break bad news? It is to relief of anxiety and better adjustment with the disease process. Because we have to relieve their anxiety. What is happening to me? Why I'm going to the hospital? Why people are not talking properly to me? So I'm anxious. So I would like to know why, so that I can adjust with my disease. And of course, it is a sharing of ideas and feeling between the professionals, patient, and family members. We are going to share with them what is it exactly. And it is like giving information and trying to understand also about their doubts, clarifying their doubts. Proper guidance, reduce isolation, acceptance and trust, and of course, settling issues and fulfilling wishes. That is very important. Okay, so let us see. So when should we break the news? So bad news is always bad news, right? Only its impact can be lessened by our communication style. So breaking bad news can be an ongoing process also. I can break the news when the patient is very distressed of not knowing what is happening with the patient. Patient is always rushed to the hospital, always taken to the chemo department, given medications always. Patient is having nausea, vomiting, and patient is doubting what is happening with me, but nobody is telling. So patient becomes distressed. So how the patient will show the distress? He may not take medications properly. He will start fighting with the family members. He may not eat properly. Okay. Or when the patient is repeatedly asking you, what is my diagnosis? The patient asks you, what happened to me? Why you are taking me to the hospital? Why the doctor is not talking to me and talking to you people? In that case also, we have to disclose them. Or when it is crucial to get the consent of the patient for the treatment. See, you're going to take the patient for a surgery. I need to tell the patient why I'm going to do a surgery. It is a crucial because treatment we are going to start. It can be chemo, radiation, otherwise dialysis. Maybe you're going to amputate the leg. Let it be anything. It's all a bad news only. Even amputating one's limb is also bad news. So we need to take the consent of the patient. So need to explain to the patient about it. That is very important. Now, breaking bad, who should do the breaking bad news? Now, Sister Mehbooba was saying, okay, doctors have to do that. Otherwise, who is in charge of the department and who knows the information? That's very right. Those who know the patient and the family very well. And those who can support the patient and family and have the skill of conveying the message. A nurse can do, but if the nurse doesn't have the skill of conveying it, it's going to be very difficult. So she should not do it. Otherwise, suppose the nurse has taken full information of the patient and the family, and the nurse has the full confidence enough that I can break the news, you can do it. Because usually what happens after hearing the news, maybe they will become little emotional, maybe they will be angry, otherwise they may start crying, keep quiet, anything can happen. So we need to handle that situation also. Okay. So, and those who know the disease, the prognosis and the treatment. So you need the full information of the patient's problems, of the full information about the family. How is the family with the patient? If the patient had any other episodes of fainting when the patient had heard something bad, something like that, if it is there. So we need to take all the information from the patient and of course from the family also. Then go ahead for breaking bad news. And when you sit with the patient, that setting should be there. Everything should be set. We usually say spikes. Setting should be there. Set the place. Quiet place. There should be privacy. All the team should be there with you, because team is very important. Team also should be there with you. You should have full information about the patient. Okay, full information should be there about the patient, and then only sit for breaking the news. And then we have to invite them also, the patient and the family, what they would like to know. That is also important, no? What they would like to know. It is not that everything you're going to give. This is like giving a big cake, full, take it. No. Just find out what they would like to know. Find out how much they know and how much they want to know also. That is also important. Suppose the patient knows a little bit that something is wrong with me and is not much bothered about that. He's bothered that what treatment you're going to give me. So the patient may say, yeah, you just tell me what you can do for me. So we need to give only that. If the patient is not interested to listen to but the diagnosis and rest of the things, he needs only about the treatment. You can talk only about the treatment. So the person who is going to break the bad news should have the full information in hand. So set the right physical context, explore the level of awareness, we say, explore what the patient wants to know, as I said, and sharing the information. Okay. That is knowledge. The knowledge you should have the knowledge, the full information about the disease, what treatments, options, everything you should have. It's not that half the way you sit only talk about the disease and you don't know what is the treatment. No. The full information you need to know before breaking the news. So that is why I said the person who is who knows everything, in the sense who have the full information, he has to sit with the patient and talk to him.
Yeah.
Okay. Now, explore what the patient wants to know. As I said, find out what the patient wants to know. Maybe the patient already got a clue from somewhere that he is suffering from cancer. Otherwise, he has renal problem and he has to go for dialysis. So explore what the patient wants to know, how much he knows, and what he want to listen from us. Okay. So we say that we can give a warning shot to the patient, then pause, brief information, and check the clarity. Why this checking the clarity we talk is, see, now I am talking to you people. I'll be talking about 40 minutes to 1 hour to you people. Usually what happens is, I'll be talking half an hour, you must have listened to me, and half an hour it must have gone above your head only. This happens. With a patient, what happens, family, when you are giving a shocking news, as soon as they hear the shocking news, after that there is a pause. After that, whatever you tell, sometimes it won't go inside. So we need to stop find out how much they want to know, find out, clarify what they heard also. That is another important thing. See, I will tell the patient's family. Now the patient is there. I'm going and telling the family member, patient was already bad, put in ventilator. His BP was very low. Suppose think like that. Okay. I told the family member, the patient's condition is very bad. We have put the ventilator. His BP is very low. And we are trying our best. The second day, I'm going and telling them, the patient's BP is better today. That doesn't mean the patient is okay, right? Okay. But I need to clarify, because if I tell them the patient's BP is better today, they may think that the patient is also better. That is what they are getting in. So I need to clarify with them what I said and what did they hear about it, what does it mean to them. So I can ask them, I told you this, what does that mean to you? We have stopped this drug and we have started a new medicine for the patient. That doesn't mean that new medicine means the patient will, act to this medicine. So I need to find out from them, whatever I say, what is the meaning for that for them. Okay. So check the clarity. And then we have to handle the reaction and the future plan. So how we are going to break the bad news? You can ask them, for what this was done for you, why the scan was done, otherwise why the biopsy was done. Any idea? Maybe they have some idea about it. They may say, it is, I just know that this biopsy is done to find out any incurable disease or cancer-like disease. We can ask also them, what do you think? Because surely they must have gone to some hospital and shown, doctor must have told that we have seen a growth and we want to know what type of growth it is. So only with biopsy we can find out. And what is biopsy, doctor must have told, because most of them, they say we are cutting and removing that growth. We will send it for investigation. So find out from them, any idea why this investigation is done? And suppose the patient says, yeah, I know this investigation is done for cancer. So next step, you can say, yes, very right. This is done for cancer. And what do you think about your tumor? We can give a pause. Patient may say that, I don't know, maybe it is normal. May say that, yeah, I feel it is a cancer because I'm suffering from these and these things. So if the patient says, I'm suffering from cancer, you can say, yes, very right, what you said. Yes, you're suffering from cancer. And we have lots of options of treatment. And would you like to discuss, or you want some other time to discuss? Or suppose the patient says, I don't know what it is. You can tell the patient, see, There are two types of tumors. One is abnormal and one is normal. But your tumor in the biopsy, it turned to be abnormal. So it means it is a cancer. It is abnormal. So you have already you break the news. After breaking the news, take a pause. Then ask the patient, you have any questions to ask me? Patient may ask, may not ask. Don't give the full cake to the patient. Give it in small chunks. So that's what I said. When a patient comes to you, first and foremost, make a good rapport with the patient. Greet them. Hello, Mr. Raman, please sit. Who has accompanied you? Your wife, your children? What brings you over here? What was the problems? Which doctor has seen you and what did they do? These things we can ask so that we can bring the patient near to us. That is, we are establishing a rapport with the patient. You can invite the patient, you can ask the patient, what do you like to know? And how much you want to know. Whatever you tell, we'll go accordingly. Inviting the patient. Because you have the full knowledge about that. This is whom we are going to talk. And remember one more thing. You have to acknowledge the patient's emotional problems also, because the patient will become emotional. See, perceiving is one thing. Okay, how they perceive what we are saying, that's where we have to clarify the things from the patient. Okay. But apart from that, that emotional state, that is important. Maybe the patient will start crying when they come to know that I am suffering from so-and-so thing. So be with the patient. Maybe your touch can help the patient. Otherwise, your presence can help the patient. Allow the patient to cry. Don't stop the patient crying. If the patient is crying, let the patient cry. Let the family cry. Be there, but after some time, you can ask them, can we go ahead or we need to sit on some other day? And if the family says, no, we can't hear more, we are already so sad after hearing that, okay, well and good. Anytime you want, we can have a talk. Don't force them, no, you have to sit in here. I don't have time. I will tell everything. Nothing like that. Because emotional thing is something, once they become very emotional, then nothing goes inside. So we acknowledge the emotions of the patient and the family. Then we have to summarize the strategy. Summarize. These are the things what I have told you, what you have heard. If they have any doubts, you have to clarify it and then go ahead. Sometimes even this happens, patient must have heard something, otherwise patient must have gone to the radiotherapy department and saw that they are giving this current. Usually they say current, no? Radiotherapy. Patient have some idea about it. And still the patient is coming and asking you, sister, I'm suffering. This one, I went to the department, they have given me a radiotherapy. Am I suffering from cancer that they are giving me current? So you can ask him, why you ask me this question? Because he has a doubt inside. Then you can sit and talk to him about that. Yes, your report says like that. That's why your radiotherapy is given to you. And still, if you want to have more clarification, you would like to know more things, you can ask me. But whenever you sit with the patient, you need time to talk to the patient and family. Without having enough of time, don't talk, because half you will talk and then you will leave the patient and go. No, full time you have to be there with the patient. because there will be a lot of doubts for them that you have to clarify. Then only we can plan the next things, next step. Okay. So this is about breaking bad news. I said spikes. Setting spikes. SP. It's the perceiving. I is invitation. K is knowledge. E is for emotional. S is for summary or summarizing or strategy. Okay. Now, handling collusion. What is collusion? What is collusion? Anyone? What is collusion?
Agreement, ma'am.
What agreement, Mehbooba?
Secret agreement.
Secret agreement. In the sense, saying not to tell, right?
Yeah.
Yeah. So family is coming and telling the doctor, otherwise the sister, don't tell the patient about this disease. Otherwise the patient is coming and telling. It's an agreement to keep the secrecy. Okay. But we have to acknowledge the reaction and the relative's concern also. So that is also important because they love that person. That is why they came and told you, please don't tell. There may be some reason behind it. Just 1 second. Sudeep, make session mein Sudeep. But now, acknowledge it because they may be having something in their mind they know about this patient. Maybe the patient must have told that if I suffer from some dreadful disease, incurable disease, I will commit suicide. Otherwise, maybe patient many times when he not able to tolerate such things. So they are very scared about the patients because they love him, love the person. So they will come and tell you, please don't tell. We will handle everything. No problem. That is collusion. So that is why we need to explore why. Why did they tell about this thing? Is there any problem behind it? Explore it first. Then the next comes is, okay, you are telling, we are not going to tell. But can you just tell me, how does it affect that person? See, usually what happens when there is a collusion and the patient doesn't know about himself, about what is happening with the patient becomes very distressed. He won't be cooperative. There will be a lot of problem between the patient and the family. And especially what happens is, many times it happens, the patient's family will never allow the patient to talk with anyone because they are very scared, thinking that someone will come and tell him. Someone comes and visits the patient, they will tell, very sad, Mr. Raman, yesterday only I came to know that you are not well. Now the patient got it, not well. So what the family will do, they will never allow anyone to come and meet the patient because otherwise he will come to know. They will stop. Even the family members itself, there will be a gap between the patient and the family members because they are also scared. Whenever they go to do some care for the patient may ask, why you are giving me so much of care? Why you are giving me so much of medication? Why you are doing this? Why you are doing that? So how it affects the patient and the family? And without challenging, in a good manner, you can reassure them and tell, be open to them and tell, it is better to break the news to the patient because now he is so much distressed. He is not cooperating. He is not taking the treatment properly. But maybe after he comes to know that he is suffering from so-and-so thing, he may start taking his treatment properly. His anxiety will reduce, his distress will reduce. But it should be in a non-offending manner. You should talk to them. And one more thing. See, the patient is coming and asking you every now and then. Patient is asking you, why this happened? What is happening to me? I would like to know. So ask the family member, see, You are saying not to tell, but he's coming and asking me every day. Whenever the patient is coming to the OPD, he's asking me, doctor, please tell me, sister, please tell me, what is wrong with me? Why nobody is talking to me? Why all people are murmuring here and whispering only here in groups? Nobody is coming and meeting. Usually we all meet together, but nobody is now coming and meeting me. So that you can tell the family members, see, if you feel that if we break the news, that will be a problem. So why don't you break the news? Because you know him very well. So let them break the news. So I still remember there was something like that only. I met a patient's husband, and he said that to doctor, you please don't tell, I will tell. It was a collusion also and a breaking bad news. Both happened. And he actually went and told his wife. He said, she took little of time and all. Then he told her that, see, I would like to talk to you. I need to talk to you about something. And finally they sat. And he said, see, your report has come. So wife asked it, see, what is in the report? So he said, see, in the report, something is there in the report which is very important. But I am there with you. We all are there with you. We will support you. You need not get afraid of anything. So he was saying, when he was telling these things, she just held him so tightly, it seemed. And he was saying that he knew that it was something was going inside her, that fear was there, and she was holding me so tightly. And slowly, when he said, see, I got the report, and the report is saying that you are having breast cancer. And that's the time he saw that she started crying. But he told me one thing. I asked, then what happened? Then he said, but one thing, good thing happened was, when I told her this is what has happened, she just kept her head on my shoulder, and she started crying, and I was just held her like this. Okay. And for a little bit she cried, then she stopped, and then she said what treatment they are going to give me. So when I asked him about this, he said, I felt better, because if a doctor could have told my wife, disclosed the diagnosis, all the doctors or nurses are not the same. They won't come and touch her. Maybe she must have cried loudly, and that situation must have become very bad. But I felt it was good that I told her about it. But of course, I was not knowing about the treatment and all. I told her, for the treatment and all, we'll go and talk to that doctor. But that is how he handled the collusion and breaking the news on the same thing. It simultaneously this has happened. Okay. Because he knew about his wife very well. That is why he did it. But here in palliative care, of course, sometimes in some cases where the doctors, like this one, Mehbooba's sister was saying, making a patient's death, otherwise patient is in terminal illness, patient may die at any time. When we say, doctors used to call the family member, make them sit, and slowly we used to tell them. Okay. And that time the doctor used to be very near to the patient's family. Sometimes they just touch them. Okay, the support, then don't get up and go off from that. They see that one person, one of the healthcare provider is sitting next to them. That is very important. And that point, they need some support from the healthcare providers. So in a non-offending manner, you can handle collusion, because collusion, what happens now, when the patient doesn't come to know the things, what is happening around him, he becomes so distressed and so uncooperative that everything goes out of hand. So you can just talk to the patient and the family, find out from them why and how we can do it. And handling reactions and difficult questions. As I said, acknowledge the reaction. It can be anger, It can be crying, it can be silent, any type of reaction, and explore the concern also. Why I become angry? Yeah, I understand you will be angry because you heard about your disease. Why? The patient will express their feelings. Maybe they have some things to take, some some decision to be taken. That's why angry, because that's daughter's marriage is fixed. And here the diagnosis. He's angry with the God. He may be angry with you. He may be angry with everyone. I won't be able to see my daughter's marriage, my son's marriage. That is why he's angry. Please listen to him. Let him express the feelings. You have to ask, why the patient asked me this question? How long I will live? That we also don't know. Any one of you know how long you're going to live? None of you know. We don't know how long we are going to live. Even if we are we are suffering from disease also, we don't know how long we are going to live. The day will come that time we will go. Nobody has given us the time and duration and all. This day, this minute, this second you will go. And we cannot tell the patient also this thing. And when you don't have an answer, please remain silent. That's the best thing to do. Patient has asked, am I suffering from cancer? I will die soon. I don't know exactly. Are you suffering from cancer? I did not explain anything. I just kept quiet. I was just looking at the patient's face for some time. Then I asked, why did you ask me this question? Then he said, the same thing has happened with my auntie also. My aunt had the same problems. And this is what has happened. The same problem I am also having. So that's what this report is showing. Then we can explain the rest of the things. But in some cases, we have to remain silent, especially the patient is saying, how long I will live? When will I die? This we don't have any answer, and don't find solution for the patient, okay? You can give only options and explain the options properly. Let the patient find out the take this their own options or their own solutions. Do not find solutions for the patient. So communication is best learned through experience, as I said from the first session. This is just a framework, okay? Because I have told you everything, please don't go and break bad news tomorrow itself. No, it will take time. You need that experience. In small things, you need experience so that you can slowly move forward. Identify your skills and try to refine them. Okay, what are your skills? Are you a person who talks very fast? Are you a person who gets angry? Are you a person who gets irritated? You know yourself. So you need to identify your skills and your shortcomings and try to overcome them. If you don't have a skill of good communication, please don't go and do a bad communication. With experience, you will learn how to do a good communication. And there are no fixed guidelines for a communication. So this is the only way you can talk to the patient, or this is the only way you have to go, nothing. Only remember, it should be patient-centered and context-oriented. Okay. If you are gone to the patient to talk about the collusion, please be there for that collusion. That context should be there. Don't go out of that box. And it should be patient-centered. And never try to imitate others. Never try to imitate Shah Rukh Khan or Amitabh Bachchan or Hema Malini, whoever it is. Okay. We cannot become just like that. We should have our own way of, our own style of communication. Just try to find out from in yourself. Do I talk very fast daily to everyone? Do I get irritated, or do I always interrupt and ask questions? If you are a person like that, then you have to try to overcome these things, so that when you sit and talk to a patient, it will be easy for you. So refine what you are talking to the patient. Refine your skills and your shortcomings, overcome them. And learn from your seniors, your juniors, from left and right, but take only the good things. Sometimes you must have watched your seniors, how nicely they communicate. So learn from them how they communicate. And never talk over the patient also. I always say, patient is lying in the center, both doctors and nurses standing on both the sides and talking over the patient, and patient is just looking up and down like this. Because you're talking over the patient. Please don't do that also. Always when you talk with the patients, you all have to be on one side. Otherwise, you just see the patient. Once you leave the patient, you can go and discuss about that. It's not that standing in front of the patient, but only you have to discuss. So many things are there that you have to keep in mind before going to a patient, before inviting the patient and family for a conversation and for a communication. And tell them anytime you have any doubts, you won't need to clarify anything, you please come, we will clarify your doubts. That's the invitation what we do. So with this, I'm stopping the sharing and we can go for the any senior. Is there any presentation?
We don't have case presentation today, ma'am.
Yes, dear?
No, ma'am, we don't have a case presentation.
Okay. So anyone have any questions? Collusion sometimes it's very painful. I remember my dad diagnosed of COPD. Actually, doctor told that my mom, I was not there, they told it him, don't bring him every now and to the hospital, keep oxygen cylinder at home. And whenever he is distressed, you can give the oxygen. So he was just kept at home only. But nobody told him about this. So what happens whenever he is having a respiratory problem, he will tell, take me to the hospital. Okay. So nobody had the courage. And the worst thing was my mom was saying that she never allowed anyone to talk to him also, because they were also a little bit scared. So how to tell him the doctor has told not to bring you to the hospital. But one day it happened. So I still remember one of my uncles came. Literally all were sitting in that room only so that he won't tell my dad why he had come, because for many years, I think maybe it is more than 20 years, they have never met. But he came to know my dad was not well, and so he came to see. This happened with the patients also, okay? Son has not come for the past 3 years. Suddenly one day, as soon as he felt sick, the son is coming. Now the patient will start having a doubt. Something has happened with me, that is why my son has come. Okay, so he will try to connect it and see. Same thing here also it happened. So, always standing and talking, I'll not allowing him to talk too much also. But one day it happened. So when my dad was having severe distress, dyspnea, and he said, come, we'll go to the hospital. I don't know, suddenly it came from my mom's mouth. She said, doctor has said that not to bring you to the hospital. And that was the way she broke this one. Okay, I was a bit shocked when I heard about that. Okay, then she also was shocked, because in that what to say, in that situation, suddenly it came out just like that. But then she said, after that, he never said it seemed that he wants to go to the hospital. He will say, whatever you people are doing, it is enough. Like giving oxygen, some injections and all, then you will be settled. Okay. So collusion is something that it pains. It pains not only the patient, but the family member also, because they are always under stress. So we need to relieve that. So breaking bad news is good. Only remember, very elderly patients and all, very elderly patients who are completely bedridden, no need of breaking news to them. Ma'am, sometime patient family saying, don't tell to my patient about disease, otherwise she will. That's what it is. Let me see.
Otherwise, she will more anxious. That time, what should we do?
What is she? See, patient is already anxious because she is not knowing what is happening with her. That is the first thing. Okay. And when the patient is anxious, tell them to be there. See, just like that, nobody's going to tell. Whenever they break a news, what they say is, they say, we are with you. We will see what treatment we can give to you. And if you people are there and you came to know that the family has already disclosed it, be with the patient and the family. Do not leave them there and go off to your duty room, your nurse's station. Be with them for some time. Find out for their anxiety, what is the, why they are anxious and what we can do for that. They may be anxious about the treatment. They may be anxious about the treatment, what to say, I'm not getting that. How much we have to spend for expense of the treatment, they don't know. Maybe they are anxious about it because they don't have that much money with them. How we are going to do all these things? They are anxious about that. You have to sit and talk to them about these things. Because see, just only breaking bad news won't end up. Okay, once you break the bad news, after that what happens is, next step is what option they are going to select. Anything for that, how much expense, whether they are having that much financial background. About their financial background also you should know. See, in introduction, they have told you about 4 things, right? Okay, physical, psychological, social, and spiritual. With that, you need to know about the patient's financial also. Because at least if you know about the financial, you'll come, otherwise the patient has to be sent to some government hospital or something. And nowadays, a lot of benefits they are getting from the government, central government and the state government. You people need to know about these things. So many, this one is there now, so many, what we say, benefits, like for cancer patients, there are benefits. Support is there from the government. All that yojanas, whatever is there, you need to know. And so that you can guide the patients accordingly. So why they are anxious, that you have to find out, explore it, and then you have to handle it. Any other question? I hope you people followed what I have. Hello?
Yes, ma'am.
Sini, they can hear me?
Yes, yes.
It's okay.
If you're having any queries, you can put it in the chat box, as you can unmute from
See,
your.
yeah. Breaking bad is not that easy. Okay. Don't think it is very easy also. No, it is not easy. Because before talking to a patient, you should know the patient very well, patient and family. All the information you should have in your hand. Without that, just don't go and tell the patient, yeah, your report has come and you are suffering, that tomorrow they are going to remove your kidney. Otherwise, tomorrow they are going to do dialysis because you have a renal failure. Please don't do that. Okay. There is a way of telling also. That's what I said. Quiet place, privacy, we need setting. Setting the context is very important. We need the team with us. And it's not only family, the family, patients, family also we need with them. It is just like a meeting we are doing. That is very important. You usually say it is a spikes. Breaking bad news is a spikes. But I made it a little more simpler and I thought I will tell you. We have understood you, Sister Alfin. Thank you, sister.
Any other questions?
We have understand.
Oh, thank you, Jesse. Oh, sister. You're from where, sister? Which part of India? Sister Jessie?
Most of them are from Catholic Healthcare Association, ma'am.
Acha, chai. From chai
Yes,
there.
chai there.
Yeah. Long back,
Chai.
about I think 3-4 years, I used to go to Hyderabad Chai Institution and give them the classes, sessions. Good, they all are here. All are Indians? Senior?
Yes, ma'am. We have 2 people from outside India.
One is that Silver Sister, Wow.
Sylvester,
Woo.
and one another man. Hi. If there are no questions, I think we can wind up the session.
Okay, thank you, Senior, so much.
Thank you so much, ma'am, for joining us. Hope to see you again for another session. Thank you.
Sure,
Thank you
sure.
so much. I know you
Thank
have
you.
a busy schedule with IFCON and all the other things.
No, that is also, but it was not that. Because of that, I think my laptop, no, that light was too much.